Hello everyone and welcome to your IVF information session. My name is Carol and I am one of the senior fertility nurses at St. Barts CRM, and I'm here today to take you through your treatment journey step by step over the next few minutes. We'll also have a presentation from one of our embryologists to talk you through the scientific aspect of your care, and one of our counsellors will also introduce themselves and introduce the counselling service here at St. Barts Hospital. Before you start your treatment, you'll have an individual information session with one of the fertility nurses in the team who will talk you through your own specific care plan, consent forms, and how to do your injections. The IVF process can be broken down to 6 individual steps: preparation, called downregulation, stimulation injections, egg and sperm collection, fertilization, embryo transfer, and pregnancy tests. And I'm going to take you through each of these stages individually over the next couple of minutes. There are a number of ways we can achieve the preparation and downregulation phase. The first such way is by using a daily injection of a medication called buserelin, which is given every day in the morning time at a time that suits you. We'll teach you how to give this injection at your individual information session. The role of buserelin is to shut down your own natural hormones and get you ready for the main stage of treatment, the stimulation phase. You will commence these injections approximately around day 21 or day 2 of your natural cycle, and will continue them throughout the treatment until we tell you to stop. Some of you may have a single injection of Prostap, which also acts in the same way, downregulating your body, preparing it for stimulation. This is given as a single injection, which will be administered by one of the nurses at the clinic. The downregulation phase can almost be described as putting you in a mini menopause. And with that comes some of those menopausally type side effects that you may experience. This is very individual for every woman, so you may experience some, you may experience none. So please don't panic and just be aware of what to look out for. So some of these side effects will include some hot flushes, mood changes, changes to your libido, headaches. So you may experience some headaches during the buserelin injection, so please feel free to take some paracetamol if you feel the need to. That's completely safe. You may experience some ovarian cysts, or your period might change. So it may feel that you have a longer period, a shorter period, heavier or lighter. So it can be variable. Please let us know when you come to clinic the date that your period started. So just jot down in your diary so you can let the doctor know. You may also commence treatment by using a daily pill to take for a couple of weeks before the main stimulation phase. We also have another approach where we scan patients in the first 3 days of their period and commence treatment from that point. The next time we see you will be at your baseline scan appointment. This will be a vaginal scan as you've had in the pre-treatment phase. What we're looking for at this scan appointment is we're checking the lining of your womb and measuring the thickness. We're having a look at the ovaries, and you may also have a blood test to check your hormone levels. If everything is okay at this appointment, we will then commence the next phase of treatment, which is the stimulation phase. Sometimes you may come to this scan appointment and the lining of the womb is not where we want it to be just yet. So we may get you to continue on medication or just rescan you the following week. The purpose of the stimulation injection, or FSH hormone as it's known, is to stimulate the ovaries to produce a number of follicles. So a follicle is basically a word you will hear a lot about over the next coming weeks. And this is the fluid-filled sac that contains the egg. And that's what you'll be able to see when you come and have your scan. At your baseline scan appointment, you will then be instructed on how to administer the FSH hormone. This is delivered in 2 different ways. So one may be a pre-filled pen, or the other is a powder water liquid, which we will teach you to do yourself. The stimulation injection is given once a day in the evening time at a time that works for you. This is the vaginal probe. You can see the uterus and the fallopian tube, and at the end of the fallopian tube you can see the stimulated ovary. Having taken your stimulation injections for approximately about a week, you'll then come and see us for some progress scans. So these will be carried out on a Monday, Wednesday or Friday, and it will be a quick 10-minute scan where we will have a look and see how your stimulation is progressing. What we're looking for at this scan is the number of follicles that are being produced, the size of the follicles, and also looking at the thickness of your endometrium, so your womb lining. We'll also take possibly a hormone blood test, and you'll have the opportunity to see one of our nurses after your appointment to see how the treatment is progressing and anything that needs to happen next. So we'll keep you informed on where you're at. If you're on the antagonist protocol, you'll start a second injection on day 6 of the stimulation phase. The role of this injection is to prevent premature release of your eggs during treatment. This is given once a day. With stimulation, there can be an over or under response to treatment. With over-response, also known sometimes as ovarian hyperstimulation, the ovaries go into overdrive and produce a large number of follicles. If you do experience this, when you come for your scans, we'll be keeping a close eye by doing blood tests, sometimes daily and over the weekends, to monitor your hormone levels. We would reduce down the dose of your stimulation and sometimes stop the stimulation altogether. Worst case scenario, treatments may have to be cancelled if you are at risk of developing ovarian hyperstimulation syndrome. With a poor response, a very few number of follicles are produced. What we would do in this instance is increase up the dose of your FSH hormone and monitor for further response. If unfortunately there is no further response, the treatment cycle may be cancelled. Please don't lose heart if this does happen, because what we will do is replan your protocol for next time based on the information that we've gathered from this cycle. Ovarian hyperstimulation syndrome is one of the main side effects that can occur during your IVF treatment. And this is when you've had an over response to the stimulation hormone. You'll be assessed for this, and the risks will be discussed with you in advance at your treatment appointments. We'll also keep a close eye and monitor you throughout for signs and symptoms that may occur. Some of the symptoms to keep an eye out for are shortness of breath, abdominal pain, bloating, feeling faint, reduced urine output, and generally feeling unwell. If you do experience any of these symptoms and are concerned, please go straight to your local A&E where you can be assessed. The day 10-11 stimulation scan will be the first point at which we may be able to identify that you are ready for your egg collection. We do this by scanning you to measure the size of the follicles, and from once they have got to the size of 18 millimeters or more, we can then say that you're ready to have the eggs collected. Not everybody will be ready at this point, so some of you may have to continue your injections a little bit longer. Your egg collection will be performed at the best time for you and your eggs. Once we have identified that you're ready for your egg collection, we will then confirm when to stop the injections that you have been taking over the last number of weeks. The final injection will then be given, which is the trigger injection. The timing of the trigger injection is immensely important. This is delivered exactly 36 hours before your scheduled egg collection. On the day of your egg collection, we'll ask you to have nothing to eat or drink for 6 hours before your procedure. You'll both arrive at the clinic exactly 1 hour before your scheduled egg collection time. For the partners, we'll ask you to produce your sample on the morning of the egg collection. So we advise 2 to 5 days abstinence to make sure we get a good quality sample on the day. The egg collection room may appear busy when you enter. You'll have the anaesthetist who will look after your pain relief and will be helping to sedate you, the anaesthetic assistant, the doctor, the scrub nurse, and the circulating nurse. There'll also be one of the embryologists present in the room, and all will introduce themselves to you. So what's going to happen next? Once you've been deeply sedated, the doctor will commence your egg collection. The scan probe will be placed in the vagina with a little needle attached that will then puncture through the wall of the vagina into the ovary and drain the fluid-filled follicles. Once the egg collection is complete, we will then return you to our recovery bay where we will monitor you over the next couple of hours. Once we're happy that you're comfortable and safe, we'll be then able to discharge you home. For the purpose of safety, we must ensure that you leave the hospital with a responsible adult due to the sedation that you've had. Some of the side effects may include bleeding and infection. We will give you a preventative antibiotic, an oral tablet, to take home at the end of the day. Over the next couple of days, it's very normal to have a little bit of abdominal discomfort, maybe a little bit of spotting. Keep an eye on those symptoms and let us know if there's anything you're concerned about. It's absolutely fine to have some regular paracetamol to keep on top of the pain relief, and we do encourage you to keep well hydrated with 2 to 3 litres of fluids each day. Before you leave us on the day of the egg collection, we will explain how to use your luteal support medication. This is progesterone hormone, which is used to support early pregnancy by increasing the lining of the womb and getting it ready to receive the embryos. Some of the side effects of the progesterone medication may include bloating, breast tenderness, constipation, vaginal discharge, and delays to your period.
Hello, my name's Kate and I'm one of the senior embryologists here at Barts Centre of Reproductive Medicine. Today I'd like to talk to you about what we do in our laboratory and how we use your eggs and sperm to create embryos that will hopefully lead to a successful pregnancy. The first time we'll meet you is when you attend for your egg collection. The doctor will remove the fluid from your ovaries, which will be passed to us in the laboratory. We'll use one of our microscopes to look through this fluid to find your eggs. Once we've found the eggs, they'll be washed and put into labelled dishes, which will have your name and your medical record number before they're placed in one of our incubators safely. On the day of the egg collection, we'll also require a sperm sample. It may be that you have a frozen sample in storage, or we might be asking you to produce a fresh sample on the day. If you think you might have difficulty producing a sample on site on the day of your egg collection, it's really important you let us know before the date. We can arrange for you to come in and store a sample so we have it ready as backup on the day of your treatment. Once we have a sperm sample, it will be prepared in our laboratory. The sample will be washed and the best sperm will be separated, ready to inseminate your eggs. There are 2 techniques that we use in the laboratory to inseminate the eggs. The first one we may recommend is routine IVF. If we've recommended this, we will put a set number of sperm in a dish with your eggs and leave them to interact overnight. It may be that we've recommended using a technique called ICSI, which stands for intracytoplasmic sperm injection. We'd recommend this technique if you have a low sperm count or your sperm is poor quality, or if you've had IVF before and none of the eggs have fertilised. We use a fine glass needle to inject a sperm into each suitable egg. The morning following your egg collection, we'll check your eggs for signs of fertilisation, and we will contact you by phone to let you know how many are fertilised. During this telephone conversation, we'll also let you know when we'd like to invite you back for your embryo transfer. Unfortunately, in 3 to 5% of all cases, none of the eggs will fertilise, which means you will not have an embryo transfer. If this were to arise, we'll arrange for you to come back to see a doctor as soon as possible, and we also have counselling available. The day of the transfer entirely depends on how many eggs fertilise and then how those embryos develop, so we need you to be flexible with your time in the 5 days after your egg collection. Over the next 2 to 5 days, we'll monitor how your embryos develop, and we'll be able to confirm which day we'd like you to come in for your embryo transfer. We consider your egg collection as day 0 and the fertilisation check as day 1. You will not be asked to come to the centre on day 1. The earliest we would perform your embryo transfer is at the day 2 stage, and the latest at the day 5 stage. This is a time-lapse video of an embryo that we cultured in our laboratory. It shows a fertilised egg dividing on into an embryo. An embryo at the day 3 stage should have at least 6 cells. Over the next 48 hours, the embryo will change drastically in how it looks. We no longer count the cells. An embryo that continues to develop normally should reach a blastocyst at the day 5 stage. Blastocysts look quite different from embryos at the day 2 and day 3 stage. There are 2 distinct cell lines that we grade. The first is the lining of the embryo, which is called the trophectoderm. This will form part of the placenta. The other cell line that we grade is called the inner cell mass, and this is the clump of cells within the blastocyst cavity. This will form the fetus. So, how many embryos do we transfer? We routinely transfer 1 embryo, especially if you're having a day 5 transfer. If you're having a transfer at the day 2 or day 3 stage, we can consider transferring 2, but this is hugely dependent on the quality of your embryos and whether you've had treatment before. When you attend for your appointment, the doctor will speak to you about how many embryos it is suitable and safe to transfer.
The next time we see you will be at the embryo transfer appointment. This is a very straightforward procedure which is similar to a smear test. It takes approximately 15 to 20 minutes. We'll ask you to arrive about 15 minutes beforehand so that we can get you ready and prepared and changed into a gown for the procedure. The embryo will be then passed high up into the uterus where it's kept safe and secure.
After we've transferred your best embryo, you may have surplus good quality ones still in culture that we can offer to freeze for you with your consent. You are not always guaranteed good quality embryos if you do have a fresh cycle, so it is advisable that you store these embryos. We will ask you at the time of transfer whether you'd like us to freeze these for you, and we will need an answer from you at that point, so please consider this option now. Approximately 98% of embryos survive the freeze and thaw process. There are many benefits to using frozen embryos in subsequent cycles. Frozen cycles are less invasive than fresh cycles. You require less medication and potentially fewer scans, and you do not need an egg collection. All we'd ask you to do is attend the centre for a few scans, and then we'd let you know when we want you to come in for the embryos to be transferred. If you're funding the treatment, frozen embryo transfers are far cheaper than funding a fresh attempt. If you have any questions about what we do in the laboratory, please feel free to email or phone us. I'd like to take this opportunity to wish you the best of luck and thank you for listening.
Before you leave us on the day of the embryo transfer, we'll provide you with a home pregnancy test, which will be taken 2 weeks after the embryo transfer. We'll give you the specific date to take the test. We'll also provide you with an information sheet with the do's and don'ts over the next couple of weeks. If the pregnancy test is negative, we will get you to stop the progesterone medication and await for a bleed. We'll then arrange you a follow-up appointment with one of the doctors or senior nurses to come to clinic and plan treatment going forward. If the test is positive, we'll get you to continue the progesterone medication and any other medication you may be taking. We'll then book you in for an early pregnancy scan at the clinic approximately 2 to 3 weeks later. At this point, you may be about 6 to 7 weeks pregnant. At the early pregnancy scan, we are looking to confirm the baby's heartbeat and make sure that the pregnancy is in the right place. So as I've said previously, there is a lot of information to take in today's presentation. Please don't worry about trying to remember it all. As nurses, we are here to take you through the treatment step by step and answer any questions that you may have. We really do wish you the best of luck going forward in your journey and look forward to seeing you at the clinic very soon.
Hello, my name is Teresa O'Connell, and I'd like to tell you a little bit about our counselling psychotherapy service here at St. Barts. We understand that going to the GP for those initial investigations, that in itself can feel quite overwhelming, and so we've included counselling and psychotherapy as part of your package of care. Any member of our team can refer you. Our nurses, our doctors, our embryologists, our admin team will be really happy to sort out a referral for you. If you leave our clinic and you forget to ask about counselling, please do feel you can email us. Our email will be given out with all the initial documents you get at the start of your treatment and some information about the counselling service. But if there's anything that we haven't covered, please do feel that you can just email us and we can talk it through. Counselling can either be on the phone, virtually or face-to-face, and we'll discuss this at the end of the assessment, in which case we can follow through in terms of what would suit you best. If we don't get to meet you, we just sincerely wish you all the very best on your onward fertility journey.